evidence-based program, one of 7 programs that have been identified by the federal government as evidence-based, meaning that they have a extensive research behind the program. One of the reasons why communities or different states like Nurse-Family Partnership, for every dollar that is invested, communities and states save over $5. And people say that babies don't come with instructions, so families need information and knowledge to help them with their children, particularly young mothers. Many of our families are young mothers under 20 years old who may not have had the opportunity to learn parenting skills. Anticipated program effects per 100 families. These are the cost savings. 50% decrease in language delays at 21 months. And typically, if a family is receiving Medicaid, they have all sorts of public dollars if they're spent on families so that they can receive the services that they need. So we're talking about dollar savings, 50% reduction in child abuse and neglect, 29% reduction in subsequent births between 2 years after the birth of the first child, 14% increase in time between first births. So what we have learned, what is all that to say, is what we have learned, if you increase the spacing of when, from the time that woman has her first child to the next child, first of all, she's healthier, as well as she's more likely to get on her feet. And if she's not self-sufficient, the likelihood of her thinking about bringing another child, she thinks twice about it. So that increased spacing is important. So Dr. Oles, the reason why he created this model and wants to work with families prenatally, because he believes if you can change the behavior of a mother when she is pregnant, that is the beginning point of changing behaviors. If she is interested in doing something different while she's pregnant, she's going to do other things that are different once the baby is born. And what we look for in an implementing agency, they have a strong reputation, excellent working relationships, committed, flexible and supportive, financially stable, effective, mission-driven, and focused. That makes for a strong implementing site, and indeed the community, the multi-site here in Jacksonville went through our application process earlier in December. We really want folks to be committed to implementing Nurse-Family Partnership, and we really like to work in partnership with them. And so we look for, facilitate an organization environment that supports implementation. We look for environments that are supportive of nurses, that are supportive of providing services to low-income families. And we also want them to be connected to the wider community in which they're located. And that was one crucial feature. And Carol Grady fought. You know, we typically don't do multi-site implementations for a number of reasons. But she fought, saying that the two organizations that are indeed implementing Nurse-Family Partnership are really work together very well, and convinced us that it was workable in Jacksonville. And she stood her ground, and we adjusted. And look forward to continuing to work here. But at multi-site, we figured we like to have one team with a nursing supervisor at the same place, but she fought for a multi-site implementation. Community linkages and sustainability. The client referral system sounds as if there's a strong network of folks here in Jacksonville committed to supporting women prenatally and young families. Sustainability ensures that there is a plan for cultivating and maintaining NFP champions and advocacy influence, a Nurse-Family Partnership Community Advisory Board, where community members come together to support the sustainability, because it's not just that the implementation agencies, also a broader community who are committed to having nurse family partnerships.
The team's already preparing to go out to Denver for their intensive training. This is an incredibly intensive project that I think complements the services and certainly addresses the need that we have, and we look forward to working with Julie and her team. But the coalition will serve as the community advisory council, because when we went through the list of the responsibilities, it didn't make any sense to establish a separate community advisory council, because all of you would have been asked to be on it. And so you'll be hearing reports, implementation reports, and certainly it will be part of our advocacy activities. But we think it definitely meets a unique needs in our community, and we're excited about participating. So thank you, Julie. Thank you for your patience and your understanding of our unique assets.
But thank you for